HESI EXIT Medical Surgical Nursing, Mastering the Immune and Hematologic Systems. Introduction. Welcome to our comprehensive review of the immune and hematologic systems for the HESI EXIT exam. Today we'll explore understanding immune and hematologic system functions, recognizing common immune and blood disorders, applying nursing interventions in immune and hematologic conditions. These systems are crucial because they protect against infections and maintain proper blood function. Nurses monitor for immune deficiencies, anemias, clotting disorders, and blood cancers. Immune system overview. Let's examine how the immune system protects our bodies. Innate immunity. First line of defense including skin, mucous membranes, and infection-fighting cells. Adaptive immunity has two components. Humoral immunity. B cells produce antibodies against specific threats. Cell-mediated immunity. T cells directly attack infected cells. Major immune organs. Bone marrow, spleen, lymph nodes, and thymus gland. Common immune disorders. Several conditions can compromise immune system function. HIV/AIDS, progressive immune system destruction by the HIV virus. Autoimmune disorders include lupus and rheumatoid arthritis where the body attacks itself. Hypersensitivity reactions range from mild allergies to life-threatening anaphylaxis. HIV/AIDS understanding. HIV/AIDS progresses through distinct stages with different characteristics. Disease process. HIV specifically targets CD4 plus T cells, progressively weakening immunity. Disease stages. Acute stage, flu-like symptoms during initial infection. Chronic stage, asymptomatic period that can last for years. AIDS, CD4 count drops below 200, allowing opportunistic infections. Diagnostic tests. ELISA and Western blot tests, CD4 count monitoring, and viral load measurement. HIV/AIDS nursing management. Comprehensive care focuses on treatment and prevention. Medical treatment. Antiretroviral therapy to suppress viral replication. Preventing opportunistic infections. Prophylactic antibiotics and keeping vaccinations current. Patient education priorities. Safe sexual practices, strict medication adherence, and infection prevention strategies. Anaphylaxis, severe allergic reaction. Anaphylaxis is a life-threatening emergency requiring immediate action. Common triggers. Food allergies, insect stings, and medications like penicillin or NSAIDs. Critical symptoms. Airway swelling, difficulty breathing, dangerously low blood pressure, and widespread rash. Emergency management. Priority intervention, epinephrine injection into the muscle. Additional treatments include antihistamines, corticosteroids, oxygen therapy, and 4 fluids. Autoimmune disorders. 2 major autoimmune conditions affect multiple body systems. Systemic lupus erythematosus. Characteristic symptoms: butterfly-shaped facial rash, joint pain, and organ damage. Management: corticosteroids, NSAIDs, and immunosuppressive medications. Rheumatoid arthritis. Symptoms: prolonged morning stiffness and joint inflammation. Management: methotrexate, disease-modifying drugs, and pain control measures. Blood system components. Understanding blood components is essential for hematologic care. Blood components and functions. Red blood cells transport oxygen throughout the body. White blood cells defend against infections and foreign substances. Platelets, essential for blood clotting function. Plasma, liquid component carrying nutrients and hormones. Hematologic diagnostic tests. Key tests for blood system evaluation. Complete blood count provides. RBC count detects various types of anemia. WBC count identifies infections or immune system disorders. Platelet count evaluates blood clotting ability. Additional tests. Coagulation studies, PT, INR, and APTT evaluate clotting disorders. Iron studies, ferritin and TIBC help diagnose iron deficiency anemia. Anemia types and treatments. Different types of anemia have specific causes and treatments. Iron deficiency anemia. Causes: inadequate iron intake or blood loss. Symptoms: fatigue, pallor, and tongue inflammation. Treatment: iron supplements and dietary modifications. Pernicious anemia. Cause: lack of intrinsic factor prevents vitamin B12 absorption. Symptoms: nerve problems, tongue inflammation, and weakness. Treatment: regular B12 injections. Sickle cell anemia. Cause: genetic disorder producing abnormal hemoglobin. Symptoms: pain crises and organ damage. Treatment: hydration, pain control, oxygen therapy, and hydroxyurea medication. Sickle cell crisis management. Sickle cell crises require prompt intervention to prevent complications. Crisis triggers: dehydration, stress, infection, and cold exposure. Emergency management. Remember HOP. Hydration with 4 fluids. Oxygen therapy. Pain control with appropriate medications. Prevention strategies. Infection prevention through vaccines and prophylactic antibiotics. Bleeding disorders. 2 major bleeding disorders require different management approaches. Hemophilia. Cause: deficiency of clotting factors 8 or 9. Symptoms: excessive bleeding and joint bleeding episodes. Treatment: factor 8 or 9 replacement therapy. Disseminated intravascular coagulation, DIC. Process: widespread clotting depletes clotting factors, causing uncontrolled bleeding. Symptoms: small skin bleeding spots, excessive bleeding, and organ failure. Management: heparin in early stages, blood product replacement. Leukemia, blood cancer. Leukemia involves uncontrolled white blood cell production. Disease process. Abnormal white blood cells multiply rapidly, suppressing bone marrow function. Types. Acute versus chronic leukemia with different progression rates. Common symptoms: fatigue, recurrent infections, and easy bruising. Treatment options: chemotherapy, radiation therapy, and bone marrow transplantation. Blood transfusion safety. Safe blood transfusion requires careful monitoring and protocols. Pre-transfusion requirements. Verify patient identity and ensure blood type compatibility. Assess baseline vital signs. During transfusion, stay with patient for the first 15 minutes. Monitor for adverse reactions including fever, chills, rash, and low blood pressure. Post-transfusion care. Monitor vital signs and watch for fluid overload signs. Blood transfusion reactions. Different reaction types require specific interventions. Febrile reaction. Symptoms: fever and chills. Management: stop transfusion and give fever-reducing medications. Allergic reaction. Symptoms: rash and itching. Management: antihistamines. Stop transfusion if reaction is severe. Hemolytic reaction. Symptoms: back pain, blood in urine, and shock. Management: emergency response with immediate transfusion cessation. Nursing priorities in immune and hematologic care. Essential nursing interventions for these patients. Laboratory monitoring, CBC, white blood cell counts, and clotting studies. Infection prevention, hand hygiene, vaccinations, and protective precautions for low white blood cell counts. Managing anemia and bleeding risks, monitoring for complications. Patient education, medication compliance, and lifestyle modifications. You've now mastered the essential immune and hematologic system concepts for the HESI EXIT exam. Remember that the immune system protects against infection while the blood system maintains proper circulation and clotting function. Common disorders include HIV, various anemias, sickle cell disease, leukemia, and bleeding disorders. As nurses, we play crucial roles in monitoring laboratory values, preventing complications, and providing comprehensive patient education. Keep practicing these concepts and you'll be well prepared for success on your HESI exit exam. Outstanding work on your nursing studies!